We're going to begin with a brief look at how this is going to play a part in healthcare reform in your business as these people relate to what you do every single day. Just a couple of moments about how you see your relationship with small business and the impact that it will have.
Thank you. I think when, from our perspective at Blue Cross Blue Shield, there is, as Tom said, there is a lot going on with this bill and a lot that we're still waiting to understand from the federal regulators on the bill. So it's going to be a time of great uncertainty in the sense that I tell the story that 3 sentences from the actual federal law turned into 80 plus pages in regulation when they actually said what that 3 sentences mean. So that's the environment we're going to be operating in over the next several years. So one of the most important things you can do is get together in forums like this, talk to each other, talk to your advisors, your insurance advisors, your tax advisors, about what's going on and how we're going to deal with all of the uncertainty. You can certainly come and talk to the folks at Blue Cross to do that. So that's the number one thing, is we're going to be in an environment of uncertainty and emerging regulation, I guess we'll call it. And so what do you do in that environment? I think there's 3 things to pay attention to. One is you could get all balled up trying to think about, well, what's going to happen 5 years from now and 3 years from now. Setting your sort of focus on a time horizon that's sort of manageable might be one of the most important things to do. Otherwise, you might get overwhelmed. I get overwhelmed when I think about all the things that are coming. So focusing on the most immediate things, I think there's 3 categories. Everyone who does offer health insurance to their employees is going to have to make some sort of change to those benefit plans coming out of the new regulations. So you'll be hearing about that from Blue Cross in the next upcoming week about our plan, how to enact all of those changes coming up. The second one is, as Tom pointed out, beyond just the offering of healthcare benefits at what levels, with what coverage, all of that sort of thing, there's a whole category of what we're calling administrative changes, including the reporting to the IRS, putting healthcare costs on a W-2 form, auto-enrolling people into a health plan instead of saying, well, if you really want the health plan and you start work here at this company, you can sign up. People are signed up, they have to choose to opt out. These sort of requirements that will be important. And the last is that with all of the uncertainty, change, and complication, things don't get relatively easier to offer health coverage. We understand that, so take all the help you can get. And that small business tax credit is one of those things that if you are under, 25 employees or under, make sure that you talk to your advisor about whether that's available and eligible for your business to help you afford that healthcare insurance that we understand is hard to afford.